in public health. We have the tools to end it. Let's use them.
Governor Abbott's diagnosis is calling renewed attention to the use of Regeneron's monoclonal antibody treatment. Can you discuss how it works and at what stage during infection it's administered?
It's given in the first 10 days after diagnosis, which is important because we have a lot of people in our community who kind of wait to see if they'll get better before going in and getting medical care when they're not getting any better. But we have treatments that have to be given within the first 10 days. There is now a regional infusion center again. So you have to get a referral from a provider, which if you don't have health insurance, it could be one of our federally qualified health centers like CentralMed or Communicare. But you need to be referred in, and it's an IV treatment that you get as an outpatient.
Dr. Wu, on that same topic, is it normal, because the governor's office says he's not having any symptoms right now, so is it normal for someone to be treated with this antibody treatment that is not showing any symptoms?
Yeah, so the criteria for who can get the antibody treatment have relaxed over time. That's another thing that we're trying to get the word out to medical providers about. So for instance, you used to have to be obese, and now if you're overweight, you qualify, which is a lot of people already in San Antonio. For providers who want to know more, they could go to the Bexar County Medical Society website. There's also information about evidence-based treatments for COVID at the Bexar County Medical Society, well, through the Medical Society. I hope it's on their website. I haven't looked lately, but I know that they've got the list that was put together by some doctors at UT Health.
Mayor Nirenberg, what are your thoughts on the Department of State Health Services requesting at least 5 mortuary trailers to be set up in Bexar County as a precaution?
Well, to be clear, we learned about that at the same time you did yesterday. But again, it is indicative of what the state expects and has expected for a couple of weeks now, from what I'm told it was ordered a couple of weeks ago. And that is that the amount of death we are going to see as a result of the Delta surge is so much that they don't think that local hospitals around the state are going to be able to handle it. Now let that sink in for a minute. If that's where we're headed, why don't we do everything we can to prevent it, especially when the tools to do so are so simple, like wearing masks, particularly for our young people who are not eligible to be vaccinated, and for those who are, get vaccinated using one of the variety of available vaccines that are free, that are safe, and have undergone the most rigorous testing of any vaccine in the world. Sounds pretty simple.
On that same topic, sorry, do we know why they're being housed? Those 5 are being housed here in San Antonio?
Yeah, my understanding after talking with folks at STRAC is that the state hospital obviously has plenty of space, the Center for Infectious Disease, but also San Antonio, as we have been a Center for Emergency Operations regionally, we're centrally located, and they can deploy to where they're needed from our location quite easily.
Do any hospitals currently have any refrigerated trailers? Are they using any, like they have at their own, that we know of?
We can get back to you on that. I hadn't heard that.
I have not heard that. I talked to George Hernandez at University Health earlier this afternoon. He did not mention that, so I don't think that.
I wanted to ask about hospital statistics. Did I hear you correct in saying there were 209 new admissions today?
That's right. We've been hovering around 200, I don't know, for about a week and a half, 2 weeks now. That level is as high as it's ever gone. And we've been there for, again, a couple of weeks now. And we've consistently seen, 10 to 15% of those admissions being pediatric admissions. So while we see some cessation in numbers from one day to the next, having that level of new admissions on every day means that EMS units are out on the road, we're getting calls, hospitals are getting slammed, and so if you have an emergency, we're going to see, as we have a week ago, the potential for somebody to say, well, you got to hold on a minute, or 26.
So it sounds like that the the concurrent number of hospitalizations has dropped slightly. So are we seeing a high number of discharges from the hospital as well as these people are getting admitted?
So that's a dangerous thing to speculate, Joey, again, because we may see one day drop, and then the next day shoots up. And we saw that in the previous surges as well. So I would not draw any conclusions from seeing one day a little bit lower than the rest.
It's still, Joey, still, if you look at just the last couple days, we were at 1335. Over the weekend, it went up to 1413, and then it just went down about 30 to today. So I certainly wouldn't draw any conclusions that indicates a trend. Just after it declines one day, particularly when you have 209 new admits, which has been acknowledged as the highest level throughout the last 18 months or so. So still a pretty dangerous situation we're in with respect to the hospital bed space and staffing at those hospitals.
And Dr. Wu, the pediatric cases, you had said that there were 29 pediatric cases admitted. Do you know the number of pediatric cases that are in the hospital altogether?
I think I said 24.
Okay.
And we have requested that information. I don't have it for you tonight, but once we have it, we can have our team send it to you.
Or do you know the availability of pediatric ICU beds?
That is also something we've requested.
Andy, I wanted to ask about the current status of the court battle. Have you heard if the governor has filed an appeal, and if so, in what manner?
The governor has filed an appeal to the Fourth Court of Appeals, which is the appropriate court to file an appeal to. So it's right now going to be in their hands. No court has yet overruled or taken away the mandate we've issued. So procedurally, there's maybe some argument that the appeal does, but we filed something with the Fourth Court to clarify that it doesn't. So again, right now, the last court that's ruled on it is the 4th District Court, and that was yesterday.
Are the city's COVID testing sites reaching capacity daily, and is there a need to expand testing sites?
With regard to our capacity, again, we are confident with what we offer. We have a number of sites across the city. Right now, I believe we're around 3,000 or 4,000 tests that we are administering per day. But at the end of the day, we have ample capacity. We depend on the partnership with our healthcare providers, with the providers in the community. So right now, we talk about our free COVID testing sites. We have ample opportunities for folks to get the COVID vaccine. It's free of charge, but we're not concerned today about capacity.
Is Metro Health considering renewing its contract with community labs?
That contract never went away. We still have it, but we didn't. Those 2 testing sites that Community Labs was at, those are also, Parks and Recreation centers that Parks and Recreation reclaimed. But that's why we wanted to be very sure that we have those 13 additional sites, and we did I can't remember it right now, I don't want to say it wrong, but we did a lot more than 4,000 tests a day previously, and so we have a lot of room to grow.
Commissioner Rodriguez, how many patients are being seen at the Infusion Center at Freeman Coliseum, and is it having any impact on our local hospitals?
So I couldn't speak to the impact, but I think right now over at Freeman, they're seeing about 100 patients a day. I think yesterday was about 125. I haven't gotten the number from today, but over the last few days, it's averaging about 100 folks. And again, those are folks that may ordinarily go straight to the hospital, but they're getting the treatment to hopefully prevent them from going to the hospital. But I think it's too early to tell what kind of an impact it's having on the hospitals.
You have another Metro Health question. Can you tell us what the hospital and staffing situation looks like this week, and what's the immediate plan of action moving forward?
That's a Strack question. I'm not going to. I can tell you, talking to my colleagues who work in hospitals, it's tight. It's still tight. I'm going to piggyback on things that Mayor was saying, but do we want to be in this for another few months, or do we want to be in the pandemic for another year or more? A lot of it depends on how much we get vaccinated now and take these measures like wearing a mask, because if we get to where another variant goes free, the way the Delta variant has, with the number of unvaccinated people we have, this is not going to end anytime soon.
Andy, if I can ask another legal question. So when the governor put in his request to the Fourth Court of Appeals, was there any type of expediency that they were asking for, or is this a bit maybe slower than the city was expecting?
This was not an emergency request for, it wasn't an emergency request for relief. But again, in their appeal, they did state that they thought procedurally it might have the effect of removing the TI. Again, we don't agree with that, and we filed something to clarify that. But there's no hearing that's been scheduled, and we haven't filed any substantive briefs on it. So we're not expecting anything anytime soon from the Fourth Court, other than responding to our request to clarify that the TIS indeed is still in place.
To clarify, sorry, the request from the governor's office, are they saying that because the Fourth Court, or because the TRO was overturned by the Supreme Court, that the TI would not be in place? Like, what's their...
Oh no, what they're arguing is simply a procedural matter in terms of, just by filing the appeal. There's some instances where that's the case, but this is not one of them. So no, they simply used a procedural argument, not anything the Supreme Court said.
They're saying that should negate the temporary injunction for now.
That's correct.
Oh, and this is a question for Claude. It's now from the school districts on how to handle mask mandates. Is there still a little bit confusion, discussion, all of that?
I'm going to ask Dr. Wu, since you did have a conversation with the superintendents last night.
The schools are in a tough place. Some of them have gotten a threatening letter from the state attorney general's office. So it's difficult, right? But really the choice is between helping to stop this pandemic or expediency. I think that most of the schools are just strongly recommending, and I understand why they feel like they're in that position, and I don't know that it's going to be enough, but I guess we'll find out.
And just adding, again, we're running the numbers. We know the number of children who are under the age of 12 who are not yet eligible to be vaccinated. The whole point of this is to protect those who can't protect themselves. So we recognize the consternation. It is a right question in terms of just confusion. We're trying to message it, working with the superintendents to make sure that they're clear about what options they have. But let's be clear, the science shows that masks are effective. We know about the science of vaccines. We're trying to promote this. We're trying to protect these kids. So that's where we are right now.
And meanwhile, I do want to point out, we have example after example of some of the largest districts in the state doing right by their children and by their communities by mandating masks and making sure that their staffs are masked up and vaccinated, even here locally.
Do we happen to know how many school districts were contacted by the Attorney General's office?
And Andy, I had asked this yesterday, but has there been any change in the city's plan on enforcement for school districts that don't do it, or is it more of a request to school districts to enforce a mask mandate?
Well, no, it's not a request. I mean, our order is in place, our mandate is in place, but at the same time, we're not going to hammer any school districts right now because we understand that the legal situation remains fluid, and so we're not going to get into the activity of trying to intimidate any school districts, which is frankly what the AG seems to be doing in their letter. But we're not here to bully or to intimidate. We're here to try to address a pandemic.
That's all we have tonight. Thank you.